afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me again is interpreter Margie Prop, and thank you so much, Margie, for your services. On my early morning run today, something caught my eye. It was still pretty dark out, but a tree full of yellow leaves stood out in the early morning dawn and reminded me that this week, fall officially arrived. And while today's 90-degree weather makes it still feel like summer, autumn's cooler temperatures soon will have us all spending more time indoors. And as we start to head back inside, we do lose some of the safety advantages with air circulation that being outdoors provides us. With that in mind, let's recommit to the basics. Let's wear our masks, watch our distance, keeping 6 feet from others, and wash our hands faithfully. In the absence of a vaccine, these simple steps are our best defense against COVID-19 and will work to keep our community safe and healthy this fall. For more detailed information about COVID-19 and the resources available to residents and businesses during the pandemic, of course, we want to remind you to once again go to our website, covid19.lincoln.ne.gov, and there you will find our dashboard with the latest data and information about our local conditions. And we update that dashboard daily at about this time. And of course, at the website, you will also find our COVID-19 risk dial, a color-coded tool that communicates about the level of risk of transmission in our community. We update the dial every Friday, and for the fourth week, the dial remains in the mid-orange area. Orange indicates that the risk of transmission remains high. Here's where we stand today. An additional 119 individuals in Lincoln and Lancaster County have tested positive for COVID-19. The total number of lab-confirmed cases is now 6,137. Our total recoveries identified to date are up from 2,284 to 2,353. Our health director, Pat Lopez, continues to recover from the virus at home, and we very much look forward to her return. But we are fortunate to have a strong bench in the health department. And one of the health professionals who works every day to keep us safe is Scott Holmes, our environmental public health division manager. And he's back again today to provide more information about the risk dial and the indicators we use to determine the position of mid-orange. Thank you, Scott.
Thank you, Mayor. Good afternoon, everyone. In determining the level of risk to the public, the health department uses local information about what is currently happening in the community, along with 3 weeks of data in 5 primary areas. So far this week, we've had a total of 461 new cases. Last week, we had 536 new cases reported. That was the second highest total so far. The high was the week before, 690 cases, the week ending September 12th. Our biggest challenge over the last few weeks has been an increase in cases among college students. Again, this is a concern for the entire community because those students don't stay on campus. The good news is that we are seeing the results of educational efforts on our local campuses, as well as successful strategies to avoid further spread with testing, isolating those who are positive, contact tracing, and the quarantine of high-risk contacts. Despite those efforts, we are continuing to see a wider community spread of COVID-19 to other age groups, including those who may be more susceptible to being hospitalized with severe illness. This chart shows the percentage of positive cases by age group over time. On the left side of the chart are the percentages from the week ending August 29th, and on the right side of the chart are those percentages so far this week. You can see on the left side that at the end of August, the area in the light gray, which depicts ages 18 and 19, and the area in the yellow, which depicts 20 through 22, accounted for over 56% of cases at the end of August. So far this week, those age groups make up only about 16% of the new cases. At the same time, cases in all other age groups have increased. The green area that represents the 25 to 29 age group increased from 4.6% to 11.7%. The dark blue area is the 30 to 39 age group, which increased from 6.9% to 16.8%. The brown area is the age group 40 to 59 and shows an increase from 14 to 27.4%. And the dark gray area at the top represents the 60 to 79 age group, which has increased from 6.6% to 10.5%. The shift to broader community spread to multiple age groups is now causing illness, impacting workplaces, and causing an alarming increase in the number of COVID-19 patients in Lincoln hospitals. Today, 65 COVID-19 patients are hospitalized locally. That's the highest number yet. The number of Lancaster County residents hospitalized has increased from 11 on September 18th to 31 today. That is also a new high. The number of patients from outside Lancaster County who are hospitalized here has increased from 20 on September 18th to 34 today. The 7-day rolling average of new daily cases also shows the rapid increase in cases we've seen this month. After topping 100 at the beginning of last week, we are now seeing a leveling off at about 80 new cases a day, which is still very high. The average weekly positivity rate had stabilized between 12 and 13% over the past 3 weeks. However, this week it has increased again to almost 17%. As of today, nearly 74,000 people have been tested in Lancaster County, and testing remains widely available in the community. Over 4,600 tests were completed last week, and so far this week, about 2,700 tests have been completed. Turnaround time is a factor we have no control over, but it is extremely important. The sooner the lab reports are received, the sooner investigations and contact tracing can begin. This is how we prevent outbreaks and clusters. The turnaround time for receiving tests this week has decreased from about 2.7 days to 2.3 days. And about 82% of the lab results were received within under 48 hours. Since September 1st, our public health nurses have been able to complete 88% of the investigations within 24 hours of receiving the lab report. Again, the position of a risk dial is determined by the current local information and multiple data indicators from the previous 3 weeks. This map shows the metrics plotted on color-coded risk areas. Toward the bottom left, you will see that testing availability is near green. Toward the middle and elevated yellow, you will find the ICU availability, testing, turnaround time, and contact tracing. Toward the upper right, we see that all the remaining metrics are in the orange shaded area. You'll find the location of the risk dial, represented by the blue square outlined in red, near the mid-orange section. As this pandemic continues, it has become clear that many of our normal activities can continue safely when we follow the recommendations and take the necessary precautions. Perhaps the most obvious example of this is the successful return of our children to K-12 schools in Lincoln, Malcolm, Norris, Raymond, and Waverly. It's clear that we can safely have kids in class during the pandemic with masks, physical distancing, hand hygiene, screening for COVID symptoms, and engineering controls like physical barriers of plexiglass. We've also seen what happens when the safety precautions are not taken. When college students returned and began socializing without wearing masks and without social distancing, we saw dozens of new cases of COVID. This past week, we identified an outbreak due to adults not wearing masks or keeping physical distance from others at a social event at the Lincoln Eagles Club on September 11th. So far, we have identified 16 associated cases with that event, and at least one person has been hospitalized. Approximately 75 people attended the event, and we believe there may be many more cases. Not all of those who are attending were from Lancaster County, and we're very concerned that some may not be aware of their potential exposure. This puts many others at risk of potentially contracting this very contagious virus. If you know of anyone, or if you or anyone you know attended this event, please contact our communicable disease program immediately at 402-441-8053. Our public health nurses will give you guidance on how you can protect your health and the health of your loved ones, friends, coworkers, and neighbors. Thank you.
Thank you, Scott. This week's outbreak and the rise in cases among our middle and older aged residents demonstrates that we cannot afford to let down our guard. The Eagles Club outbreak has put at least one person in the hospital and exposed dozens to the virus. The spike in cases among college-age students is now spreading the virus throughout the community, leading to a concerning increase in local hospitalizations. The rise in community spread puts our entire community at risk, and our entire community needs to be part of the solution. Each one of us makes choices every day that can impact our health and the health of others. Our choices can affect our schools, our businesses, and our healthcare system. As the pandemic progresses, we continue to learn more about this very contagious novel virus. Misinformation is rampant, but we know this for sure. If we rely on the science, if we continue to implement these proven strategies and continue to take the necessary common sense precautions, we can have power over this virus. In general, the more people you interact with, the more closely you interact with them, and the longer that interaction lasts, the higher your risk is of getting or spreading COVID-19. Please consider the level of risk before going out. Please stay home if you are sick, and please make the right choices. Wear a mask, watch your distance, and wash your hands. Even while we all work to keep our distance, we plan to come together this next week to look inwards. Residents are invited to tune in to a virtual citywide community address on Monday or Tuesday of next week titled Invitation to a Journey of Belonging, Creating Cultures of Equity and Inclusion. The featured speaker is John Powell, one of the nation's foremost public intellectuals and civil rights leaders. He will speak to how we can create structures and cultures that invite us to bridge across differences and cultivate our innate belonging and connection with one another. The program will also feature participation by the University of Nebraska men's basketball coach Fred Hoiberg, former dean at the University of Nebraska College of Law, Professor Anna Shavers, and Associate Professor of History and Ethnic Studies, Dr. Jeanette Eileen Jones. We want to thank all of the incredible community and business partners who've signed on to help promote and sponsor this event. We're so pleased that over 1,300 Lincolnites have already RSVP'd. And for those who would like to join us, the address will be aired on both Monday and Tuesday at 11:30 a.m. on Link TV, or you can watch online at the Link TV YouTube channel. Finally, we're excited to share news that the Lincoln Manufacturing class is currently accepting applications, and those will be accepted through October 1st. This 6-week class, offered in partnership with Lincoln Literacy and the Lincoln Manufacturing Council, provides an opportunity for people with no prior manufacturing experience to learn about manufacturing and access high-quality manufacturing jobs. The class is free and comes with a stipend as well as transportation assistance. And students who have completed the class in previous runs have now found work at Kawasaki, in Exhaust, Lincoln Industries, Agility Fuel Solutions, and more. So if you want to learn more, please email info@bridgewaylnk.org. That's info@bridgewaylnk.org. And with that, we'd be happy to open it up for questions.
Mayor Riley with the Journal-Star with a question for Scott Holmes.
Be right here.
Good afternoon, Riley.
Good afternoon, Scott. I had a couple of questions. First, wanted to ask, with our hospitalizations, how close are we to a level of hospitalization that would concern the health department and require some changes to surgeries, outpatient, non-COVID related hospital care, like earlier in the pandemic, where non-elective surgeries were not allowed. How much capacity do we have at this point, even as high as we?
So, sort of two questions there, Riley. The first is, how concerned are we about the hospitalizations? We're very concerned about the hospitalizations. Having over 30 Lincoln, Lancaster County residents hospitalized from this virus is really concerning. We have never really been the ones that have been talking about how we need to save the hospital from COVID. We're trying to protect people's health. However, the hospital systems are well aware of their situations and patient counts. We have a plan, a surge plan, that would accommodate multiple more people if needed. Currently, the ICU is about 70% full. That's concerning as it continues to fill up. But they do have the capacity to turn other rooms into ICU-type rooms. Staffing is always an issue with hospitals, and the concern, of course, is do we have enough nurses who are actually ICU trained to be able to manage the patients that will come if they come more. So we have a good, strong plan. The hospitals are very collaborative with us and with each other, and we have capacity to manage the situation.
A second question, with the positivity rate, and I think I heard you, essentially the health department views the positivity rate or level of infection in the community as sort of affected by the return of college students and some of those early upticks in gatherings that happened when college students returned to campus. But how does the positivity rate now and the level of infection compare to earlier in the pandemic?
The positivity rate at this point is pretty similar to when we had the outbreak that was due to Smithfield Crete. At that time, the percentages were probably in the 13+% range. The most recent number will probably come down a little bit with additional test results coming in over the weekend. But if we're in the 15%, 16% range, that's very high and very concerning.
And as a follow-up, is there a number or a percentage that is sort of a concern percentage where it would drastically affect the ability for your contact tracers to keep up with new cases?
I don't know that those two things are directly correlated, Riley, but as far as levels of concern, we would ideally like to see our percent positivity be below 5%. It had been below 10% for multiple weeks, and we felt that that was a level that we could sustain and continue to manage. When you get to above 15%, what we have seen is that that's when it gets really difficult because the spread becomes more rapid, and we are very concerned about our numbers right now.
Hi, Scott. This is Jeff Robb with the Omaha World Herald. Can I follow up on a question that Riley had?
You bet, Jeff.
What is the trigger that would require the implementation of the surge plan?
The surge plan is always basically in place, meaning that it exists and the hospitals rely on that. They developed it in collaboration with us. Each hospital has their own surge plan, and then we also have a plan that involves collaborative work between the hospitals and even some other facilities in our community should it need be. But anytime they're getting upwards of their ICU capacity, that's when the surge plan will be already implemented so that they can handle any further growth in the number of cases that need intensive care.
So I'm just trying to understand then, where are we at in relation to that, and what is the next step that could be implemented?
Well, we're at 70%. The next step that would be implemented would be modifying where they take care of ICU patients. They would reduce their other patients coming in. That could be through reducing elective surgeries or having those patients in other hospitals. And that would be a question which I think would be better answered by the hospitals themselves. But the bottom line is that they do have capacity and plans in place to modify caring for more COVID patients.
Scott Riley with a question on the Eagles outbreak.
Sure.
Is that club sort of being investigated for possible DHM violations by the health department?
Right now our focus is on identifying anyone else who might have been exposed and ensuring that they get proper testing, care, guidance from public health nurses so they know what to do, and potentially identify anyone else that they may have exposed so that we can hopefully contain that outbreak.
I guess my question being, would they qualify as an establishment allowed to, I guess, allow dancing on site?
The way the state DHM was written previously and the way the current DHM is written locally, they are considered a private club which could allow dancing.
I have a question for the mayor, if I could.
Yes, hi, Jeff.
Hi, Mayor. This is Jeff Robb again. Are you considering any further steps or health measures to respond to the trends that you're seeing now?
We haven't had that discussion at this point because, you know, what we are also optimistic about is how effective the administrative and engineering controls are when people utilize them. As Scott mentioned, we are not seeing outbreaks in our schools throughout the county. And of course, Lincoln Public Schools being the largest public school system, that is very heartening. So I think what you heard in Scott's comments was that we have the ability to prevent these kind of outbreaks, and we know the steps that are helpful. It's wearing masks, it's watching your distance, it's washing your hands, and it's utilizing things like plexiglass and other engineering controls that can reduce the possibility of transmission of droplets that would affect individuals in those indoor environments. Of course, we are continuously monitoring, and if our data starts to suggest that that is necessary, we can have that conversation. But right now, we are continuing to emphasize the common sense steps that everyone can take to have a role in being a solution. This isn't rocket science. It's public health, and each of us can make a difference.
Mayor, would you put into a DHM restriction of elective surgeries or hospital procedures if it came to it?
First off, I just want to remind everyone that our health director is in charge of crafting our DHMs, and we are in a more restrictive DHM than the rest of the state right now. But with regard to elective surgeries, the hospitals have largely been in charge of those decisions, and I think I don't want to misspeak. I believe that they may still have a reduced elective surgery load today, but I have not recently had that conversation with the heads of our hospitals, but they are constantly monitoring and managing so that they can continue to provide care to those who need it. And we are so fortunate in Lincoln. I just want to thank Brian and St. Elizabeth, CHI Health. They are collaborating, monitoring their ICU capacity and working together to potentially, share patients if need be in order to make sure that patients get the care they need here in our community. Other questions?
I had a question, Riley, with the Journal Star. Is the Eagles outbreak, is that sort of the most recent outbreak since the sort of Smithfield-related outbreaks from earlier in the year?
I'll let Scott take that question.
Riley, I would say no. We had multiple outbreaks on UNL campus, as you may recall. We had multiple outbreaks in sorority and fraternities. We had an outbreak on residence hall. So those were also outbreaks. Those are situations where quarantine was used to reduce the spread. And so I would not consider that we go all the way back to Smithfield Creek.
More of a general question. Has the virus sort of presented itself differently at this stage of the pandemic in terms of the level of hospitalization and the number of or the kind of symptoms, or has that locally at least?
I wouldn't say so, Riley. There's been no real change in that. I think what's changed is we are much more out in the world now than we were early in the outbreak. Our mobility, our going to social events, watching our kids play football, multiple additional ways we are getting exposed where early in the outbreak we were not. And that's why it's so critical that people wear masks, watch their distance, and wash their hands. You asked earlier about the DHM and its applicability to the Eagles Club. Had they been wearing masks, the majority, we would not have this outbreak. I guarantee it.
Any further questions? All right. Well, thank you so much for tuning in today, and thank you for joining forces with all those who are wearing their masks, washing their hands, and watching their distance to protect friends, family, and neighbors from COVID-19. We appreciate you, and with your help, we will get this virus beat. Thank you.